is your day to get real answers to all of your questions about breast self-exams and mammograms. It is week number 2 of Newsom's House Calls, a breast cancer awareness campaign for the entire month of June. I'm celebrating my 5-year anniversary as a breast cancer survivor this month by encouraging men and women to get screened. And we have Dr. Linda Harrison, who is a radiologist with Diagnostic Imaging Centers. Thanks so much for being here. Let's just start at the beginning. What age should we get screened? I mean, American Cancer Society says 45. Komen is saying 40. What do you say?
You know, Cynthia, it is a confusing subject, and it seems like every 6 months somebody comes out with a new set of guidelines. So what's a woman to do?
Right.
We advocate following the American College of Radiology and the Society of Breast Imaging guidelines, which is to start imaging with a screening mammogram if you're at average of risk at the age of 40, having that mammogram done every year. And the reason for that, Cynthia, is at the age of 40, that's when your risk for breast cancer starts to go up. It keeps going up until the age of 75. Okay. So your main risks for getting cancer are being female and having breasts. So, you know, we think, a lot of women come into me and they think, I don't have to have a mammogram, I don't have any family history. But the reality, Cynthia, is 75% or more of women who have a first diagnosis of breast cancer have no family history. Their only risk factor are being a woman and being over the age of 40. So we recommend starting at the age of 40. And it's interesting, the American Cancer Society guidelines, again, they say they strongly recommend starting at the age of 45 and doing it every year. But they go on to say every woman should have the opportunity to undergo screening at the age of 40 if they want.
I see. So, all right, so there we are, 40.
I'm telling women you should want to have your screening start at the age of 40.
Now, what about self-exams? When should we start those? As young women and, you know?
And Cynthia, that's a great question too. We don't have screening methods for women under the age of 40 if you're at average risk in general. And the only way we find cancer is if you, your loved one, or your doctor finds something in your breast. So I recommend, and again, Komen guidelines also suggest starting those monthly exams at the age of 20. It's a good idea. Get used to what your breast is. I think it's really important to know your own personal risk and to be proactive. And the way you be proactive is to know your breast, know what it looks like, know what it feels like. If you sense changes, go in to see your doctor. It's likely it's nothing, but we do see breast cancer. The youngest breast cancer patient I've had was 20.
Wow, that's incredible.
We see breast cancer in women who are in their 20s and pregnant. We see breast cancer in women who are breastfeeding. It can happen at any age, usually after the age of 20. And again, if you see changes, knowing your body, if you see changes, go in and see your doctor.
All right, I want to show you some video because we want to talk about the different types of screening. Which is best? There's the 3D new technology imaging, and then there's the older technology. I know when I was getting diagnosed, they didn't have tomosynthesis, the 3D imaging. Kind of show us what's going on here and tell us which is better.
So 3D or tomosynthesis is the newest development in mammography, and basically it is still a mammogram. It uses low-dose radiation, and the machine is going to move in an arc across the breast, allowing us to get very thin slices through the breast tissue. So what this helps us do is we can separate out normal tissue from abnormal. I'm looking at the breast as thin slices rather than as one two-dimensional image of a three-dimensional object, your breast. So it allows us two things. We're able to separate normal tissue from abnormal. So we might have to have fewer of those workup tests, those areas where we say, oh, there's something, I'm not sure what it is. We can separate that out much easier on a 3D mammogram than we can on a 2D. The other thing we're doing, we're finding small invasive breast cancers more frequently with the 3D mammogram than with the 2D.
And the earlier it's detected, you know, the more likely the survival rate.
Absolutely.
All right, we still have not talked about men. We're out of time, but don't worry. You're going to be with me for a Newsom's House Call tomorrow at my home, and you're going to talk about men and breast cancer, men and screening, and we're going to talk about any questions that you have. She's going to answer them, so be sure and just log on to the KSHB Facebook page tomorrow morning at 9 a.m. and every day at 9 a.m. this month for Newsom's House Calls. Thank you so much, Doctor, for being here and for sharing great information. Thank you.
Thank you, Cynthia.